we usually do the pledge and the prayer as always, just in time. So I'll go ahead and start with the pledge, and the Vice Mayor will lead us in prayer. So, pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
I didn't know I was praying tonight. Short, sweet. Heavenly Father, we thank you for today. We thank you for the opportunity to come together, Lord. We thank you for the people we're going to hear from today and the education that we're going to receive. We ask that you let us receive that education, let it sink in, and that we become healthier individuals because of it. In your name we pray.
Amen. All right. So we're going to go ahead and jump into what we all came here to do, which is to learn. And April Kelton with Advent Health is here. And April, the floor is yours.
Thank you. Okay. Nope, that's not. Sorry. Good evening, everyone. How are you?
Good, how are you?
Good, thanks. Thanks for coming out. I appreciate it. So I'm April Kelton. I am the outpatient dietitian at the Land and Fish Memorial. So I'm part of the diabetes, but also nutrition. So I do see patients that do not have diabetes as well. But November being National Diabetes Month, here to talk about diabetes. All right, so we're going to talk about a little bit what is diabetes, the risk factors and steps to take for preventing it, and or if you have it, some general guidelines to manage your diabetes. So just some little quick statistics. You don't have to memorize them or anything. It just kind of shows you that over 34 million people have diabetes in the United States, and that 26 or just under 30% are diagnosed, but that 7.3 are actually unaware of that they have diabetes or pre-diabetes. So we do see that a lot in clinic. Patients come in like, I was never told, and usually does not happen overnight. It's usually brewing. You can be pre-diabetic from anywhere from 5 to 10 years. So just making sure that you keep up with your doctor's appointments and your annual physicals and routine lab work can help with that to make you aware of it. Of course, type 2 is a little bit more, or I won't say popular, but more diagnosed with type 2 than type 1. So how do you know if you're at risk? Online, there is a risk factor test. It's based off, of course, your age. It's going to ask you if you're female or male. Have you ever had gestational diabetes, which is when we're pregnant, we have diabetes. It can go away, but that puts you at risk later in life for diabetes, usually type 2. If you have any siblings, so we have the genetic gene, so that's the only way you can kind of catch diabetes. If you have been diagnosed with any heart disease or family heart disease, that's also a risk factor. If you are overweight or obese, so if we have extra extra filling around our stomach, that creates insulin resistance too. If we're not as active, so we're sedentary, that'll put us at risk. And if we are not spring chicken, so over the age of 40 and 45, that increases your risk factor. So how do we know for testing? So we usually are going to do fasting blood sugars. Sometimes offices will do an oral glucose test, and then of course a hemoglobin A1C. So normal blood sugars should be under 100, so if we don't have diabetes. If we're pre, it's going to be 100 to 125. And then of course, if it's above 126, along with a diagnosis of A1C, can be a diagnosis for diabetes. Oral glucose tests are usually done with gestational diabetes, not so much the general population, but they still do that. So that's when you drink that yummy sugary beverage. And then they're going to test your blood sugars 1 hour later or 2 hours later and see where they fall in the range. Of course, we want it under 139 and under 140 for or 199 for the pre. So if it's over 200, we have that diabetes blood sugar going on. Hemoglobin A1C is different than your hemoglobin general. So hemoglobin A1C is a blood test that will measure your red blood cells over the past 2 to 3 months. So that'll tell us how much sugar is sticking to those red blood cells. So a normal functioning pancreas would be under 5.6, pre is at 5.7 to 6.4, and then of course above 6.5 is a diagnosis for diabetes. Some symptoms you may or may not feel, we're usually extra thirsty, we're extra hungry, sometimes we're a little hungry or fatigued, we're running to the bathroom a lot because that's your body's way of expelling all the sugar. We sometimes have significant weight loss, like we weren't trying, so that's another indication of that we might have some blood sugar issues going on. Blurred vision, because it's going to attack those small vessels, or a sore or cut that won't heal. So we usually tell our patients to check your feet, so if you stub your foot or something like that, or even just a general cut that won't heal is taking too long, that's our way of telling us that of course you have an infection, but we can't fight it because we've got our blood sugars too high. With not knowing, or if your diabetes is uncontrolled, so if your A1C is not in target or your blood sugars aren't in target and we're not managing our diabetes, we can actually increase our risk for heart disease, and if we have a stroke or heart attack. Amputation, so when we hear people say, oh, I lost a finger or toe, that's that blood sugar not moving around how it should be, so our blood sugars are too high for that. Hence we have nerve damage, hence the amputations. Eye complications and blindness, again, small nerves. When we have high blood sugars, it's looking for smaller nerves, so that's where it's going to attack and reduce the blood flow. Of course, that can be related to kidney damage and kidney failure as well. Sexual dysfunction, again, small nerves it's looking for, or dental. In some rare cases, dentists can actually see that somebody's a diabetic if they are bleeding in their gums profusely, or they have poor dental hygiene. So it does happen, not too often, but it does happen. So how do we prevent or manage our diabetes? Well, of course, diet, right? Getting that healthy, balanced diet. We want to move. So you guys have your challenge, your May physical challenge. That's a great one to keep everybody moving. Sleep. We sometimes underestimate sleep. So making sure that you get enough sleep. We don't want to have too much. We don't want to have not enough. We want to have just the right amount so that your hormones recharge and keep everything reset. Keeping up with your doctor's appointments. So of course we need to get our labs done. So going to your doctor's appointments, maybe you need support or more education. So again, those will come from your doctor, but they can refer you out to diabetes education as well. Take your meds. If you do have meds, make sure you take them when you're supposed to take them. Certain meds work before meals and certain meds work whenever, or some work later in the day versus in the morning. Drinking water, so of course it's calorie free. Our bodies are made up of mostly water, so we want to make sure that we are hydrating. Check your blood sugars. How do you know what's going on if you don't check? Or if you don't go to the doctors, right? And another one, stress management. So if you're not aware, stress, even if we have little or no stress or a lot of stress, that can actually affect our blood sugars. So you could be doing everything perfectly, but if we're stressed out, our blood sugars could be a little elevated. So one quick question for you. I don't have diabetes, or some of you might not. Do I have to still do this?
Absolutely.
Why? You're right.
Prevent this.
Stress is the #1 killer.
Yeah.
It leads to all disease. People are not moving.
Mhm.
People think they sleep 4 hours and they're golden.
Yeah.
We need to get at least 7 to 9 hours of sleep. And you have to drink water. You need to be hydrated.
Yeah.
You need to provide minerals in your water as well. It's very
Yeah.
important. But yeah, a lot of people don't drink water. I mean, it's disturbing when you talk to people and they really just say, no, I don't drink water.
Yeah.
And you see these people drinking like these sodas,
Mm-hmm.
these humongous sodas, and I just say like,
all the added sugar.
Yes.
So yeah, even if we don't have diabetes, making sure like incorporating these with your family as a support technique. So eating healthy, moving, hydrating, absolutely. So speaking of nutrition, we're gonna dive into it. So I'm just gonna do a little basics because I could talk to you all night about nutrition. But to make sure that you are getting the right nutrients, we have your 3 nutrients: your carbohydrates, your fat, and your protein. And of course, you just mentioned vitamins and minerals too. In the back, I do have a healthy plate handout that'll give you the perfect portions and how to balance it. But we're gonna go through each section. So carbohydrates, which is also another name for starch, sugar, and fiber. So those are all carbohydrates. So meaning when you eat certain foods, such as, any guesses on starches? I know there's a couple up there. Yeah, potatoes, bread. Anything else? Yeah, cornbread, of course, bread, right? What about fruit and milk? Did y'all know that? Fruit and milk have natural sugars in them. So we do have to count those when we're carb counting. So your fruit, your milk, and your starches are gonna all turn into carbohydrates. You need this. This is what your brain works off of. But what's the key? Do we have a lot of them or a little bit?
It kind of varies, I think, when you say a lot or a little bit,
Mm-hmm.
because we also need carbs, like complex carbs
Mm-hmm.
for energy.
Yeah, absolutely.
And so, absolutely, should we be eating processed food? Probably not. So I think, yeah, there's a healthy balance. I think you never be afraid of carbohydrates.
Correct.
As long as you're consuming the right ones.
Yeah.
I think where the problem lies a lot here, especially in the United States, is that people are eating a lot of junk food,
Yeah.
So.
So making sure, yeah, like I heard you say complex carbs, that's on my next slide.
Sorry.
Or just being aware of, so the foods you guys mentioned, so fruit, milk, breads, those usually are not going to contain added sugar. So think about it, apple, milk, they don't contain added sugar unless you add it to it or it becomes apple cobbler, which is good. But anything where the manufacturer or you have added sugar to it. So we want to make sure we get, I'll use your word complex, because you're going to get a little bit more nutrients, fiber. So that's going to be the key. Fiber will help to keep anybody's blood sugars level. It's going to keep you full longer. If you're looking for weight loss as well, this will also support your blood sugars and your weight goals and stuff like that too. So your fiber is going to come from your fruits, your vegetables, whole grains, nuts, and beans. So I know you threw out the word processed, but these foods, most of them are whole foods, right? Unless until we start, cooking them or baking them, then we're kind of processing them. But in general, fruits, vegetables, whole grains, and nuts, those should be all whole foods. Because of the fiber, it's going to keep you full, keeps you regulated, keeps everything nice and easy. And I'm going to tell you to get your fiber from food first before you go through a supplement. Of course, if you need extra based on your diet, your doctor's recommendation or anything like that, absolutely, but try to get it from your food first. We also need fat, because that's going to help keep our hair and skin and nails nice and shiny. It's also going to give you vitamins, so don't be afraid of fat. There are different types of fat. So up here we have the unsaturated. So these are going to be heart healthy. They're going to go through your arteries nice and smooth. They're going to help level off your HDL, which is your heart healthy cholesterol. It's going to make food taste better. And it's also going to keep you full a little bit longer in normal amounts. So heart healthy fats are going to be your avocados, your oils, peanut butter, fatty fish such as salmon or mackerel. They'll have the omegas in there too. Sardines, yeah. They actually have good calcium in them too as well. So they're in the oil, that'll have the good unsaturated fat as well. But portions are going to be smaller of your fat. We're talking a couple teaspoons, a couple tablespoons. Protein, of course, we need. So that's usually going to be about the size of the palm of your hand. We only need about 3 or 4 ounces at a time. because you're gonna try to get protein throughout the day. We don't need a whole ton of it in one meal, because you're only gonna absorb so much, and then the rest gets stored as fat. So eating a variety, if you can do plant-based ones, you can do nuts and your seeds, but then we also have animal-based ones too, like your lean meats, eggs, of course, fish and chicken are lean, and turkey and stuff like that too. So again, trying to balance a little bit of both as best as you can to make sure that you get protein to help level off your blood sugars. So vitamins and minerals, this is just a quick slide because I could go on and have multiple slides. But as you notice on the right there, each of those pictures, do you notice how some foods will repeat in the vitamins and mineral section? Or the different colors, so we see green, we see orange, we see red, purple. So how do you know if you're getting enough vitamins and minerals? For sure, yeah, that's one of them. How do you know if you're getting enough? Yeah, if you're balancing your diet, you should be getting all of these. It's when you eat or take out different food groups, you're gonna be missing those vitamins and minerals. So we don't wanna take away fruits or vegetables, but if you don't like some, that's okay. But eating the variety of color should give you, and the different nutrients will give you the different vitamins and minerals. So how do you put this into practice? I do have the handout in the back. This is just some quick examples on the plate method. So the plate method, of course, consists of half your plate should be of non-starchy vegetables. So the easy way would be to hold up your fist. One fist is a cup, so imagining 2 fistfuls, that would be your vegetable side of the plate. Of course, that fourth should be of your lean protein. So again, the palm of your hand, 3-4 ounces, give or take. The other fourth should be the starchy vegetable. So ideally, maybe half a cup or no more than a cup, so that would be your fist size. So what does that look like in real life? So this one, we have an easy breakfast. We have your non-starchy vegetable is your asparagus, and then we've got some tomato in there. Your protein, this one, they have egg substitutes. You could definitely use regular eggs as well. The whole grain is half a potato, so we have the skin on there. Hinton, we get some fiber. And then if we're still hungry, we have for optional is 1 cup of honeydew melon and fat-free yogurt. So that'll give you some extra protein as well, and a little bit of carbs. Does that seem doable for breakfast? If you don't think you can get a cup of vegetables, at least throw some in your eggs, or even with the potatoes as well. Ooh, good question. The difference between regular yogurt and Greek yogurt, anybody know?
Greek yogurt, I always use Greek yogurt.
Mhm.
It does have more protein.
It does, yeah.
It is definitely the consistency of it is
Yeah.
for sure. But yeah.
Yep, so we usually do recommend Greek yogurt because it does have, and to show you like an example would be, works for any brand. I know there's a ton out there, but regular yogurt usually has about 4 to 5 grams of protein per like container. Greek yogurt, any brand, usually about 12. So that's almost 2 servings of protein you can get in one container. Now, of course, they're making different yogurts on the market. That some have 20, so they're putting it in different ways. But Greek yogurt will definitely give you more protein. Good question.
It does cause a little bit more.
It can, so I would tell you bulk, if you buy in bulk and then just portion it out, or generic brand. You don't have to buy I won't say certain brands, but you can buy the store brand too. Example we have for lunch here, we have tuna salad. So of course half your plate we're looking at green leafy vegetables with some tomato. Your protein's gonna be 3 ounces of tuna. FYI, a can is usually about 5, so this is just a little bit less. And then we have some mayonnaise with that. And then they have these 4 pieces of Melba toast. So these are gonna be high fiber, perfect portion, about 15 grams of carbs, but they'll be high fiber to add with your tuna and your salad. If you're still hungry, we've still got that chopped up mango, and then we've got a cup of fat-free milk. So again, remember, milk will also have a serving of protein. So this is a quick, easy one. You don't really have to cook. I won't lie, they're really dry. So you definitely want to put some stuff on them. So my personal favorite is usually Triscuits, because they have different flavors, and those do have a good amount of fiber in the serving as well. Turkey, so turkey and couscous for dinner. We have half your plate of cooked mixed vegetables. These mixed vegetables are gonna be your carrots, your broccoli, and then I think in between there is like the water chestnuts. Then we have your lean chicken without the skin. And then we have your whole grain couscous as your starch. And then if we're still hungry, we've got the applesauce and again, the fat-free milk, or you could do your fat-free Greek yogurt if you wanted to. So the idea, just to show you and give you different ideas, you can mix and match whichever protein, vegetable, and starch you want in there, but the idea is that, again, we're doing short-term goals to get to your long-term goal to achieve for blood sugar control, weight loss, so that we prevent or control our diabetes. Questions? You guys had some good ones.
Yeah, I have a question. I mean, I know the answer.
What my answer is?
Low fat. Why?
Low fat?
I mean, non-fat. Why?
Depending on your medical history, if you do have significant heart disease, we have a lot of plaque buildup. If it's high fat, it can have a lot of saturated fat. Depends on how much you're using. So I'm trying to think of an example that would be appropriate. So cheese, everybody loves cheese, right? Regular or low fat. Of course, low fat tastes different. We have less saturated. Either way, I'm going to tell you a portion is an ounce. So that's like your 2 fingers, a stick of cheese. So even if it is low fat, doesn't mean you have more of it. Does that make sense?
Correct.
Okay.
And I think, I think people don't do the 1 ounce serving. And cheese, some people think it's a high protein food.
Yeah.
It's not. It's a very high fat food. And I think people really get lost there. They just eat chocolate.
So it's funny you say that because I just had a patient today who has a history of had bariatric surgery, started gaining weight. I was like, well, what are you eating? And he told me Swiss cheese. But the amount was like, he measured it and he said 300 calories. And I'm like, well, what else are you eating with that? And he wasn't pairing it with his fruits or vegetables. So I agree. Yeah, you can eat cheese, and if you want the full fat, yes, I'm going to tell you, okay? But again, watch the portion. So have cheese if you want your crackers, have carrots, have dip. Balance things out so that you're not just having one nutrient. One, that's kind of boring, but 2, so that you get more nutrients. Yeah, that's a great question. But yeah, I will say it does depend on your health record background, because sometimes we might really do need to just stay away from the saturated fat. So cheese obviously would have saturated fat in there.
The reason I ask is because I know that a lot of products, when they're non-fat and low fat, they tend to be higher in sugar.
They take out something and add something.
Exactly.
Yeah.
And I think you need to be very careful because of that.
Yeah.
And we have so many products out there that are non-fat. I mean, me personally, I do full fat for everything, but I do it in moderation, obviously, so I pick and choose, what I want to consume.
Another good discussing. So people think, oh, low fat or fat free. Absolutely, you can do that, but the portion's still 2 tablespoons if you look on the back of the label. So again, whichever you prefer, but it doesn't mean because it's low fat or fat free you get more.
I think, what the problem is, because I started to, I don't do it anymore, but initially I started to track my macros, right? And so it's interesting when you track your macros, very interesting. It was scary.
Yeah.
You know? And, you just don't know until you start to like.
Pay attention.
Yeah, because I have a scale I use.
Oh, yeah.
And it's incredible how fast those numbers go
Mhm.
up, you know? And it's easy to forget not to add something.
Yeah.
You know, something as easy as like a tablespoon of oil, you
Yeah.
know? And that's substantial,
Yeah.
you know? So it's a good education, I think.
I like how you said that too. If you do check, make sure see how much fiber you get. A lot of people don't pay attention. They'll do all their mainstream macros or vitamins. I'm like, what about your fiber? And a lot of people have to pause when I ask that because they don't pay attention to that. So
If you use an app, it's easy
Mhm.
because a lot of the foods
Yeah.
are in there, so it is easy. That was mind blowing, the fiber
Yeah.
content. I mean, I get about 30 grams, so I was always good, but it's incredible how easy you can not get
Forget,
into
yeah.
your diet. You have to be very intentional about that. So.
Awesome. Thank you for that. Any other questions?
It's just hard shopping in stores.
Mm-hmm.
I go to the grocery store, I think there's maybe, if you took like a 20-mile grocery store, I could use a half of that,
Mm-hmm.
and that's what I can buy.
I mean, shopping the perimeter, of course, we say that. But even if we shop in the middle, getting stuff on sale, because you can do frozen, you can do fresh, especially with winter now, so things aren't going to be in season, and also to make it affordable. That's why I pay attention when things are on sale, logos or whatever, or store brands. Don't forget, it doesn't have to be the name brand fruit that's frozen or canned too. Good question.
No, I just think it's amazing how eventually for about portions.
Mm-hmm.
Now, to some people, it's like putting lettuce and tomato on a burger and salad. Serious.
No, yeah. So that's part of it. We still need to get another cup on the side.
I had triglycerides at around 14.
Mm.
Since I'm 60 years old. And then about 5 years ago, one of the doctors said, just keep on eating green leafy vegetables. I said, how much?
Yeah.
He said 2 50 cents. So I was like, well, at least until you never start coming. So I tried it twice a day. I had any kind of salad I possibly think.
Yep.
And it dropped to 300.
Mm-hmm.
1400. Following 6 months later, I ended up, it was down to like 100.
Nice.
Yeah.
That's a good job. Yeah.
By the same token, there was something, I had a very serious disease last year. And I couldn't eat anything. Bread made me sick. I could smell the yeast, it was making me throw up. And one of the few things that I drank mostly ice chips and water, and then there was apple juice and pineapple juice. So I started eating pineapple juice and cups of pineapples. And what I didn't realize was, as I was eating this stuff, it was affecting my blood thinner medicine. And my blood thinner, the blood thinning effect was so high that I ended up with a brain bleed.
Mm.
And it's just, I think, you know, if you tell people clinical studies like that, they get an appreciation for just exactly what food does to them.
You bring up a good point though. So showing you the plate, you're right. Eating vegetables just one time a day, that's not. We want to do it 2 to 3 times a day. So the plate, breakfast, lunch, and dinner. So that's why I show you. Because if we eat vegetables once a day, yeah, that's great, but we're still missing that fiber and those vitamins. So 2 to 3 times a day, fruits and vegetables. That's a good way to aim for it. Each.
Do you push people on starting out with at least multivitamin every day?
Mm-mm.
Really? Why not?
Because where could you find out if you're deficient in something? Who could tell you that?
Well, it's very simple. Once you hit 40, you're deficient in a lot of things. You just
So your blood work.
I still got a couple years.
Yeah, so blood work. Getting routine blood work.
Okay, wait a second, because he's right. He's not going to worry about it until he's 40. And then when he hits 42, he's going to wonder what happened.
Yeah.
Or it's just a one-time thing. Between 40 and 42, my vitamin D levels drop, my calcium levels drop, my magnesium levels drop. They're dropping all over the place, and I didn't change what I ate at all. It's just my age. Once you hit 40, you don't digest the same as you did when you were, like, what are you, 22?
I wish. Not that far away from 40.
Yeah, hormones are another aspect too, so that can fluctuate. Yeah.
Okay.
Thank you guys, thank you.
Thank you.
Thank you so much. Let's give April a round of applause. Thank you for a pretty awesome presentation. Well, that's it. I mean, unless you guys have any other questions, we're going to call it a night. So, no, good. All right. Thank you guys for coming out and for joining us. April, thank you so much for coming out and talking to us. This obviously is being recorded and it will be posted on the city's YouTube channel, and then I'll post it on my YouTube channel as well. So everyone have a good night.